Hello guys, today I will be demonstrating how a nurse should help her patient with a bedpan. So here are some things that we need to prepare. First of all, is the bedpan. Here I use a plastic box to as a bedpan, and a toilet roll, a pair of gloves, a plastic barrier. Here I use a plastic bag, two wet warm cloths, and a bed blanket. So now I'm going to do the first step, which is hand washing and wear gloves. After washing your hands and wearing a pair of gloves, now I'm going to inform the patient what I am doing. Hi miss, now I'm going to help you with a bedpan. Is it okay? Yes. Okay, so the first step, you need to put a bed blanket, cover your patient. After covering your patient with a bed blanket, slightly roll from the bottom of the blanket, roll the blanket up towards the patient's hips. Then bend the patient's leg. And then put a plastic barrier underneath the patient's hip. Here I'm going to use a plastic bag. Okay. Now I'm going to put a bedpan. Put a bedpan right on top of the plastic barrier and below the patient's hips. After that, I will roll back the blanket to provide privacy and raise the bed to a 90 degrees. After placing a patient in a 90-degree position, give her a roll of toilet paper, and you should inform her when she's done. She needs to tell you, or you will be back in a couple of minutes later. So miss, if you are done, you can call me, or I will be back to check up with you later. Now, after that, you should take off your gloves, wash your hands, and sanitize your hand. When the patient is done, you should wear a new pair of gloves and take the toilet roll away. Put the patient back into a lying position. After placing the patient into a lying position, you should pull the cover from the back to the front. And then take a trash bag, remove the bedpan with the trash bag. After that, place the patient into a lateral position. Then, use a warm wet cloth to wipe the patient perineal area from the front to the back. Wipe it from the front to the back. Then, throw the cloth into a laundry hamper. After throwing it, take the plastic barrier and dispose it. Then, place the patient back into the normal position. And then, cover the patient with the blanket. Then, I will go to the toilet and empty the bedpan and the trash bag, and also sanitize myself. After emptying and sanitizing the bedpan, wear a pair of new gloves and use another new warm wet cloth to wipe the patient's hands. So just give me your hand. Wipe it finger by finger and gently. other hand. After that, throw the cloths into the laundry hamper. And after that, take the bed blanket away. At the end, reposition the patient to make sure he or she feel comfortable in that position. So are you comfortable right now, Miss?
Yes.
Yes. Okay, so that's all for today.